There are some big birthday milestones in our lives. And when it comes to private health insurance, one of the most important is 31. If you're over 31 or about to turn 31, you could be impacted by the Australian Government's Lifetime Health Cover Loading, also known as LHC. So what is LHC and how does it work? LHC was created to ease the load on the public healthcare system and encourage you to take out hospital cover earlier in life and maintain it. If you don't have private hospital cover, you may have to pay an extra fee for your private health insurance later in life if you're not covered by the 1st of July that follows your 31st birthday. If you sign up for cover after the 1st of July that follows your 31st birthday, you'll pay the LHC loading. That means an extra 2% on premiums for each year you haven't had hospital cover after the age of 30, and you'll need to pay that fee for 10 years. Here's an example. If you wait until you're 35 to get hospital cover, loadings apply and you could pay 10% more than someone who took out a policy when they were 30. That's the 2% loading fee every year for 5 years. Say, for example, Bob took out hospital cover at age 30 and is paying $150 a month, whereas Michelle takes out the same cover at 35. She'll need to pay $165 per month for 10 years, which means she'll end up paying an extra $1,800 compared with Bob. The good news is, if you pay the loading for 10 years and keep your hospital cover during that time, the fee will be removed, and from then on, you'll just pay the base rate of your premiums. Also, if you have a couple or a family hospital policy with 2 adults over 31, the loading will be averaged. For example, if Michelle has a loading of 10% and her partner Peter's loading is 30%, the loading is averaged at 20% and added on top of the base premium. There are some exemptions to these rules, and if you want to know more, you can find them on the Department of Health's website. So here's a recap. If you take out hospital cover before you're 31, you'll pay lower premiums. The government encourages people over 31 to get and keep hospital cover with LHC. You'll pay an extra 2% fee on your premium each year you wait after turning 30. Your LHC will finish up when you've maintained hospital cover for 10 years. Join us today to make the most of the uncommon care we're known for.